ਮਿਸੀਸਾਗਾ ਦੀ ਮੇਅਰ ਬੌਨੀ ਕ੍ਰੋਂਬੀ ਵੱਲੋਂ ਪੱਤਰਕਾਰਾਂ ਨਾਲ ਗੱਲਬਾਤ ਕਰਦਿਆਂ ਕਿਹਾ ਕਿ ਕੋਵਿਡ-19 ਦੀ ਸਥਿਤੀ ਪੀਲ ਰੀਜਨ ਵਿੱਚ ਗੰਭੀਰ ਬਣੀ ਹੋਈ ਹੈ। ਉਹਨਾਂ ਦੱਸਿਆ ਕਿ ਪੀਲ ਰੀਜਨ ਵਿੱਚ ਰੋਜ਼ਾਨਾ ਔਸਤਨ 1 ਲੱਖ ਪਿੱਛੇ 211 ਦੇ ਕਰੀਬ ਮਾਮਲੇ ਸਾਹਮਣੇ ਆ ਰਹੇ ਨੇ। ਮੇਅਰ ਨੇ ਆਖਿਆ ਕਿ ਟ੍ਰਿਲੀਅਮ ਹੈਲਥ ਪਾਰਟਨਰਸ ਵਿੱਚ 135 ਕੋਵਿਡ-19 ਦੇ ਮਰੀਜ਼ ਨੇ, ਜਿਸ ਵਿੱਚੋਂ 31 ਕ੍ਰਿਟੀਕਲ ਕੇਅਰ ਯੂਨਿਟ ਵਿੱਚ ਨੇ। 230 ਕਮਰੇ ਕੋਵਿਡ-19 ਮਰੀਜ਼ਾਂ ਲਈ ਵਰਤੇ ਜਾ ਰਹੇ ਨੇ। 51 ਸਟਾਫ ਮੈਂਬਰ ਕੋਵਿਡ ਕਾਰਨ ਡਿਊਟੀ ਤੋਂ ਛੁੱਟੀ ਤੇ ਨੇ।
The COVID-19 situation facing Mississauga and Peel region remains extremely serious. While our case numbers in Mississauga have been plateauing for 6 weeks, we have seen some incredibly high case counts of recent days, including some single-day records. Mississauga is currently averaging 163 cases per 100,000, with Peel region as a whole averaging 211 cases per 100,000. If we are going to see a surge in cases soon from the holiday gatherings, and that will bear out in our numbers over the coming weeks. But as I've said many times here before, it's not our continued daily high case numbers that concern me the most. It's the situation in our hospitals. Right now, Mississauga Trillium Health Partners is dealing with 135 COVID inpatients, 31 in critical care, and approximately 70 more suspected cases. And that, of course, means that more than 230 rooms at Trillium Health Partners are being used solely for COVID-related patients. 51 staff are also off due to COVID, and THP is seeing staffing shortages across the entire hospital system. Over the last month and a half, more than 100 Trillium patients have been sent to other hospitals across the GTHA. I'd like to thank Halton Healthcare as well as hospitals across Toronto for supporting Trillium Healthcare. The reality is that Trillium is functioning at about 77% of their surgical capacity, and there is concern that they will have to reduce even more so. Brampton's William Osler is currently at 43% of their surgical capacity and have 110 COVID patients, 13 in the ICU, and another 64 suspected cases. The promising news is that there are many on our frontline healthcare workers who have already received the vaccine and have begun to make headway in our long-term care homes. On December 30th, I joined Trillium CEO Michelle DeManuel, Premier Ford and Dr. Lowe to receive the first shipment of Moderna vaccine that arrived in our region. So far, Trillium has vaccinated 2,600 frontline healthcare workers, and Peel Public Health has vaccinated almost 1,000 long-term care residents, their staff, and essential caregivers. I'm also encouraged that the province announced yesterday that it plans to have all long-term care residents, healthcare workers, and essential workers vaccinated by January 21st.